Jean is an associate professor here at the University of Maryland College of Information. She holds a PhD and an MS in information, library and information services specialization from the University of Michigan. Beth's research and teaching focus on the intersection of people's health-related information behaviors, information access, health literacy, and health justice, particularly aiming to identify the information-related causes of and potential solutions to health disparities. Over the past 15 years, Beth has published nearly 30 articles reporting her research on people's information behavior within the health context and beyond. These articles have appeared in many of the major journals in our field, including Library Quarterly, Library Trends, Library and Information Science Research, and many others. Dr. St. Jean has taught and teaches several undergraduate and graduate level courses related to people's information needs and information behaviors over the past decade, including 2 cross-disciplinary courses she created. Health Justice, open to entering freshmen in the University of Maryland's Carillon Communities Living and Learning Program, and Consumer Health Informatics, open to our college's MLIS, Masters in Information Management, Masters in Human Computer Interaction, and PhD students. And these 2 courses focus on the intersection of consumer health information behavior and consumer health information justice. So related to all of that, we're going to have a very broad discussion of libraries' information needs in health crises, and I will turn it, Beth, over to you.
Thank you very much. Thank you, Marianne. Welcome, everybody. I'm going to go ahead and share my slides. Let's see. Okay. Okay, excellent. So this talk, it all centers around roles of public libraries during 2 very major pandemics. And so I'm going to be sharing 3 projects with you. The first 2 are actually articles, and as we get to them, there'll be a cover slide that has a QR code, so you can go right to the article if you're interested in reading the article. And so the first article is current, relatively current, about the COVID-19 pandemic, and then we're going to take a step backward about 100 years and talk about the 1918 influenza pandemic, and then we're going to come back to closer to the future and talk about long COVID, which that project is in progress. So I'll be sharing just a little bit about it, what we're doing, and one of our participant quotes that again underscores the important roles that libraries can and do play in crises like pandemics. So this is the first paper. So this one, we're looking at all the things that public libraries did to try and help the public during the COVID-19 pandemic. And this is a paper in Library Quarterly. They had a special issue, and these first 2 mini talks are about these Library Quarterly papers that we had. And so let's see. So go through. Okay. So the COVID-19 pandemic both illuminated and intensified health disparities, and public libraries and librarians were busy adapting existing services and resources and developing new resources, programs, and services, trying to meet the public's needs for not just information, but even beyond that. And so that's what we're going to be talking about. And so this was an exploratory investigation we did into the COVID-related offerings of U.S. Public libraries. Okay. So we were really motivated to do this study by the idea of health justice. So, how are public libraries helping with health justice in their communities? So, health justice is, making sure that everybody has a sufficient and fair, equitable capability to be healthy. And that capability, you need to have resources, access to resources, including information, very importantly, to be able to have health justice. And so throughout the COVID pandemic, we've been seeing sort of a confluence of a lack of information that's accessible, authoritative, comprehensible. We also saw politicization and polarization, relating to COVID risk perceptions, health behaviors that may help. Lots of misinformation and disinformation. I'm sure a lot of you have come across that, and also a limited information and health literacy skills, just among the general public, not having sufficient literacy skills to understand and process all this huge amounts of information. So our exploratory investigation, we did an online investigation. We conducted it from March to May of 2022. And we looked at relevant Facebook groups, closed groups for library managers, people doing library programming, library organizations, library publications, and also public library websites in Maryland and Washington, D.C. And the group of us made a Google spreadsheet, and we all populated it with all the different offerings that we could find from the prior, at that point, it had been about 2 years. So from the prior 2 years. And we coded them, and then we realized that they fit into 6 buckets. So what are public libraries offering? I'm going to walk through each of these on the next slides, but physical access to information and IT, intellectual access to information, helping with information literacy skills, health literacy skills, supporting people's physical and mental health and well-being, informing, facilitating, and enabling people's health behaviors like wearing a mask, getting a vaccine, things like that, offering a safe space for people to be, running maker spaces, sometimes even making like PPE for community members, what is it? PP, it's personal protective equipment, I think it is, masks and things like that, serving vulnerable populations and addressing health justice issues in their community. So I'll just walk through each of these. Okay. So physical access. So a lot of public libraries were offering curbside checkout. Some were even offering like local delivery. And they were making sure that their communities had internet access by buying and distributing Wi-Fi hotspots, having their bookmobiles go out into people's neighborhoods with hotspots so people could connect. And they also left the internet on in their buildings so people could come and park in the parking lot and continue to have internet access there. And there's a quote on the next few slides. You'll see quotes over to the right here. And so this quote is about, the importance of curbside pickup during the pandemic. I'll just let you read that for a minute. Okay. Second bucket, intellectual access to information. So public libraries offered programs and clubs to try to help people to navigate information and misinformation. And these are just some of the examples that we came across. So like Denver Public Library was offering How to Spot Fake News, the COVID-19 edition. You'll see like there's a couple local ones in that list too. And then on the right-hand side, we have a quote that there's 2 types of viruses. There's the physical one, but there's also a virus of misinformation. Okay. And then supporting people's physical and mental health and well-being. So there's many things listed here, but like using 3D printers to print PPE, offering free at-home COVID tests, hosting story times, running free online yoga classes, stress management workshops, etc. Um, and on the right-hand side, there's a quote. People weren't getting vaccinated either due to just not having information about it or having encountered misinformation about it. And this person's making the important point, let's get the information out from sources that are trusted by people, like libraries and museums. Librarians, by the way, they've been found to be the second most trusted professional among the public in the US. The first one is nurses, interesting, and then librarians. Okay, and then helping to inform, facilitate, and enable people to engage in health behaviors like getting vaccinated, getting tested, wearing a mask, etc. Um, and so these are some of the many ways they were helping with this. They, even distributing masks, helping seniors sign up for vaccinations. That was, not an easy thing to do, especially in the beginning when vaccines were first coming out. I remember my mom, she was about 92 at the time, and I remember getting on those websites quick as I could, trying to trying to get her a vaccination. And I thought, boy, people, who don't they're not like fluent on computers, that they're probably lost trying to do this. So I think it's great that public libraries stepped in. Um, and then interestingly, on the right-hand side, Fairfax County Public Library libraries designed a campaign to encourage patrons to wear masks in the library. And their graphic artist, Liza Romero Lecca, designed 4 different signs. And this is one of hers, the smile with your eyes. Um, and the quote below it is a quote from a patron of the Hawaii State Public Library System, saying like, I wasn't gonna get vaccinated, but I went to the library and it said I had to be vaccinated. So I was okay with that. It was, worth it to me to do that. Um, and then safe spaces and maker spaces. So nearly all public libraries had closed during the pandemic at the beginning, especially. But some of them continued to help their communities in whatever ways that they could. And libraries were realizing how important it was to have outdoor spaces. And so on the right-hand side, it's talking about renovating and expanding a new city library in New York, and the importance of outdoor spaces. And I think that has stayed with us too, that, people still highly value the outdoor spaces. And then our last bucket was serving vulnerable populations and health justice. So some libraries offered programming that recognized that COVID was having disproportionate impacts on particular communities, whether we're talking about like based on race, based on gender, based on, if you have a home or you don't have a home. And so these are just some examples of those types of programs. And in the right-hand side is a quote talking about, there's 2 pandemics going on. So, for Black Americans, they were not only facing the COVID pandemic, but the ongoing pandemic of racial injustice. And so, there were some programs that talked about like that intersection, that kind of dual pandemic situation. So in looking at across these offerings of the libraries, we felt like some of them fell in the equality bucket, some fell in equity, and some fell in justice. And so um, equality is like we're just going to do one size fits all. Everybody can benefit from the same program or resource. We don't need to tailor it to people. So in the picture, everybody's got the same size, like stool or box to stand on. So the child still can't see the game, right? Because they need a larger box, and that's not been taken into account. The equity bucket, recognizes that like different people need and will benefit from different kinds of support. So you tailor your support to the individual. So now the child's been given a larger box to stand on, and he can now see the game too. And then the justice bucket, which was rarer among the resources and programs we located, um, in the justice bucket, that you're like, okay, you know what? Let's just remove the problem. So so let's just get rid of this opaque fence and put in a fence that everybody can see through. And so it's, trying to address the root causes of inequities and remove systemic barriers. So making programs and resources available to all, advertising them to all, making sure everybody can access and benefit from them. Um, so this amazes me. So back in February 15th, 2020, I'm not even sure I knew about the pandemic until much later than that. But the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, sorry, Director General of the World Health Organization, way back on February 15th, 2020, was saying we're not fighting just an epidemic. There's also an infodemic, and that fake news is just as dangerous as COVID itself. And so the way they defined infodemic is lots of information, above overabundance of information. Some of it's good, some of it's accurate, but some of it's not. And it makes it hard for people to find, the information that's trustworthy and the guidance that's trustworthy. So World Health Organization held an infodemiology conference in the summer of 2020, and they developed this public health research agenda for infodemic management, which I'll show a piece of on this next slide. And although they don't actually mention libraries and librarians, looking through their various streams that they're talking about, the public needing help with, there actually were several streams where it seemed like public libraries and public librarians are already doing a lot of this. And if they're not, they certainly can. And I pulled out stream 4 in particular and put it down the side because it seems like libraries are doing that, trying to strengthen the resilience of individuals and communities to infodemics. And you can read down the side the specifics of stream 4. Okay, so that's the first one. Um, and the second one, I'm going to take a step back in time. I'm thinking I'll spend maybe like 10, 15 minutes on each of these and leave like 15 minutes for questions at the end. So if you have questions, please put them in the chat and we'll definitely cover them. So the second piece is looking back in history. So we got curious. We're like, hey, why is this happening again? Why are we finding ourselves in such a mess? Not that the pandemic happened, but that the bad response happened, the mess happened, right? Especially the information mess, the information, yeah, big jumble. And so we looked back. This is another paper in the Library Quarterly special issue that I mentioned, and you can get to it through the QR code. And this was work with Allison Jennings Roche and Morgan Adel, who are both doctoral students here. And also with Paul Yeager, who's another professor here. Okay. So we saw that there were lots of similarities between what was going on with COVID and what had happened 100 years ago with the influenza pandemic. Lots of misinformation, disinformation, limited health literacy amongst the public, making it hard for them to deal with that misinformation. Failure of the federal government in this country to launch an organized and effective response, and all of that leading to health behaviors that, personal health behaviors that put people at risk, preventable illness and death, health disparities, health injustice. And in both of these cases, public libraries have tried to overcome the challenges that they faced in trying to still meet people's needs, and help them to navigate the misinformation and disinformation, that came about in both pandemics. Um, so a little bit about the 1918 Spanish, in quotes, influenza pandemic. So Spanish flu it's a misnomer. There was the 1918 Sedition Act that you could be thrown in prison for 20 years if you spread pessimistic stories, including like, hey, the influenza is spreading. And Spain was actually neutral during World War I, and so they were one of the very few people that were honest about the spread of influenza in their country. So they got lucky and got it named after them, even though, it wasn't a Spanish influenza. But that's how it happened. So there were three waves, two in 1918, one in early 1919, and one in three people got the influenza, and it caused 50 million deaths worldwide. And within the US, it reduced our average life expectancy by about 12 years. Um, so, in investigating this, we were curious how it was being talked about, the influenza pandemic, how it was being talked about in women's magazines of the time, of about 100 years ago. A little bit on the history of women's magazines. The first one came out in 1770, and it was called the Ladies' Magazine, or Entertaining Companions for the Fair Sex. And there was a huge growth in subscriptions from the late 1800s to the early 1900s. And it wasn't all women actually who subscribed to these magazines. Sometimes men subscribed to them too. There were a set of women's magazines called the Big Six: Ladies' Home Journal, Women's Home Companion, Good Housekeeping, the Delineator, Pictorial Review, and McCall's. And by 1919, 2 million people subscribed to Ladies' Home Journal, or LHJ. And the Big Six were very active. They were engaged in muckraking, so investigating and proposing actionable solutions to societal ills. So they insisted that when people submit pieces for consideration for their magazines, they actually come up with solutions. They don't just talk about the problems, they actually propose ways to address the problems. So we decided to focus on Ladies' Home Journal because it was the highest in circulation at the time. So we wanted to see like how the 1918 influenza pandemic was being discussed during that time, from about 1918 to 1921. And we used the How Do You Trust digital library, which is really cool, completely free. I highly recommend going there and just exploring if you're interested in like historical things. And so we found several articles that related to this idea of health justice, and that also made the point that health isn't like an individual thing; it's a community thing. That people's health depends on each other's health. And these articles also really centered women's roles as like not only ministering to help people who are already infected, but trying to contribute to help the spread of influenza further. So I'll just share a few of the articles. So Dr. Anna Howard Shaw was a physician and a leader of the women's suffrage movement. Unfortunately, she died from pneumonia a few months after this article, and a lot of the people who had influenza were deemed to have died of pneumonia. So it's possible that she actually had influenza. And she talked about the three greatest public needs of the times then. And she talked about, we need a more unified federal approach to address the influenza pandemic, with a Secretary of Health and an educated voting public, including all women. Um, and then there's a quote down the bottom here about, the lack of a coordinated response ended up with states and counties having their own laws and then endangering nearby ones because there's no dividing line, right, between states or counties that like, oh yeah, the influenza can't can't go over that line. Let's see. Okay. So the second one, Dr. Robert T. Small, he was a former war correspondent for the Associated Press. Um, and he really emphasized that, we need to prioritize disease prevention and sanitation's role in disease prevention. And he's talking about like health is not just an individual thing. We affect each other's health. People talk about like a zero-sum game. It's not like I get my health at the expense of your health. It's opposite. We have to be healthy together. If you have people hoarding, I don't know, toilet paper or something, it affects their neighbors, right? And then that affects them too, because, they're living right there. Um, let's see, Esther Everett Lape, she was one of the founders of the League of Women Voters. And she was talking about how immigrants were being forced to live in unsanitary conditions and that the effects of that weren't just limited to the immigrant areas. They spread. And so she's making the point we need to make sure that everyone can live in sanitary conditions for the health of everybody. And then Mary Roberts Reinhardt, she was a former war correspondent who worked on the front lines during World War I for the Saturday Evening Post. And she's pointing out similarly, like the U.S. public health response, she says it's in chaos and dangerous as well. And she talks about we were really unprepared to meet the flu. There was not like a central place where we had resources like money, hospitals, train services, et cetera. And I'd add information to that. And I think that is an important lesson for us to learn. Unfortunately, this happened 100 years ago. We did not retain that lesson. But I think it's important to look at, both past pandemics and see what we can learn. So knowing where our resources are, what they are, when the time comes that we need that those resources. So U.S. public libraries, during the 1918 influenza pandemic, they were continuing to serve their communities, help people stay safe. There was a lot of use of the libraries because a lot of places were closed, like you couldn't go to movie houses, things like that. So use was actually much higher than during the non-pandemic times. And there was some concern about disease transmission because they didn't know how it spread. And so there was some concern that books might spread the influenza. And so some libraries destroyed books and others sterilized them. And some public health departments actually issued rules specifically about library books. And I'll show you a postcard on this next slide. So this postcard was sent by local Pennsylvania health officers. They sent them to notify librarians not to loan books to certain households where there was a contagious disease of some type, and to disinfect or burn any library books that were already on this house's premises. Um, Okay, so during the 1918 influenza pandemic, as during COVID, librarians took on new roles. They facilitated at-home learning. They helped to distribute credible health information. But the pandemic had an impact on library workers' health and morale, and we don't know a lot about the long-term impacts on libraries and library services. But I think it's important to look back and realize these lessons can help us as we plan for future health crises, and especially like in this case, like public libraries' roles in helping. Um, this is a quote from a fantastic book article. It's called "The Fight Against NZ: U.S. Libraries During the Influenza Pandemic of 1918." It's a book by Dr. Lori Mann, who's a professor, I think, at Florida State University, and she makes the really important point that we should retain this memory, right? Because 100 years have gone by, and we're different people now, right? There's no one who was an adult during the 1918 pandemic is still here to share the lessons. And so she's pointing out it's important to maintain this institutional memory of how libraries continued to help during pandemics. So this is a complete side project, but in doing this research, I came across like a lot of misinformation and disinformation about not pandemic, patent medicines. So people claiming like, oh, if you eat this food or drink this water, it's gonna either prevent you from getting influenza or it's gonna cure you. Not true. And so I really just dug into that. And I'll just maybe spend like 2 minutes on this. But it was very interesting. Collier's Weekly started this Nostrum, Evil, and Quackery series of books. They called it The Great American Fraud. Trying to expose patent medicines. And the Journal of the American Medical Association actually formed a propaganda for reform department, and Dr. Arthur Cramp headed that up, and they were investigating all of these like medical frauds and quackery. So yeah, patent medicines were rampant in America. I guess we were leading the world both in manufacture and consumption of these patent medicines. And they were called patent medicines, but they really weren't patent medicines because you couldn't get something patented unless you revealed your formula. And they, of course, didn't want to say what was in them. And so they were really more proprietary medicines, but they called them patent medicines. And here's a warning poster like, hey, don't use these patent medicines. Almost all of these are frauds and humbugs. But so lots of misinformation and disinformation. And so the next set of slides look through like how it was handled in Ladies Home Journal, and then also just gathers together some of the ads and what people were claiming. But the editor of Ladies Home Journal was one of the very early people to say, no, I'm not taking patent medicine ads. Excuse me. Mute myself. Okay. But he was very active in, taking a voice against these patent medicine, frauds. And let's see. Okay. So there was lots of misinformation and disinformation. These patent medicine ads, they even went to people's homes and said, hey, can I paint an ad on your barn or your fence or something so we can help publicize these patent medicines. And one of the really bad things, there's a lot of bad things about these medicines, but one of the really bad things was that it really reinforced health disparities because they tended to be less expensive than paying like for a doctor's appointment. And some people couldn't access a doctor. Maybe they lived rurally or it was too expensive. And so these actually exacerbated health disparities. Um, but yeah, there was lots of misinformation going around. There were the public libraries of the time held some, they called them public library lectures, to try and like dispel some of this misinformation and make people aware of it. Yeah, and then these are just some examples. We'll share the slides, I'm sure, and you can look through them. But this is like food, so oxo fluid beef fortifies your system against influenza. Horlicks malted milk, the diet during and after influenza. This was an interesting thing. This was Pluto water. It was actually a laxative. And they were making claims too. They actually had a whole spa where you could go and um, I don't know, try and get healthy with this Pluto water. Just gonna move this. Okay, let's go through it. So all of a sudden you see down the bottom, Pluto for Spanish flu, guard against this dread epidemic. So all of a sudden they're saying like, oh, our product helps with this too. Um, and then the propaganda department did some investigations and said, their claims are outrageous. And yeah, uh, and etc. Cough drops, boots. There were food faddists who I don't know if they were real doctors, but they said they were doctors, and they claimed that like eating certain foods or eating certain diet could help you not get influenza. Um, Dixie cups did like fear appeals. Influenza sits on the brim of the common drinking cup. Oh, this one's actually really sad because this product, it was sold for a long, long time, 1880s to 1950s, and it was a lamp called the vapocresylene. It emitted cresyline, a disinfectant that was made from coal tar, and it vaporized over a small lamp that was lit with kerosene. And let's see, there were yeah, they claim, simple, safe, effective, and it helps with all these things, asthma, influenza, coughs, bronchitis, da da da. Um, but, when they looked into it, they said, it's actually very dangerous. It caused health problems. And then a lot of the next few ads are about Bauer Chemical Company in New York that sold quotes remedies, these 3 remedies that they said were safeguards against the flu. And similarly, the propaganda department investigated them and said, they're false. Their claims are false. Yeah, so one of these was Formamint, a mint that you sucked, and they said that it would help you prevent from getting the flu, and it was made of formaldehyde, which was toxic, and it damaged your skin, your eyes, respiratory system, etc. Um, and then Genaspirin. Um, oh, and then this was not actually a product, but this was the interchurch, the interchurch world movement of North America that was claiming that the influenza came from the Orient 30 years ago and that nearly all plagues are Oriental plagues. And they actually think, they don't know for sure, but they actually think influenza originated in Kansas, not in the Orient, but they're not sure. And I don't know if that will ever be sure, but so there were important lessons learned from that pandemic. And there, some of the same things that happened, right, just during COVID, that like we didn't have a good government response, lots of misinformation, disinformation, the importance of preparing people with health information literacy skills, and how libraries, are in a unique position to help people. They're trusted, they're in people's communities, and they're information experts. They can help people to get access to good information and assess information and tell whether it's good, reliable information. So that's the second one. And the third one, I'll just mention very briefly. So this is COVID long haulers. We're working on this right now, and I'll let you read through the list of people collaborating. It's quite extensive, but it includes several professors and doctoral students here at the university across departments. And so we just wanted to know about the information needs, practices, and experiences of COVID long haulers and what motivates them or impedes them in seeking information and using information. So long COVID is when you have symptoms beyond 3 months after testing positive. And our goal is to better prepare for future pandemics from an information standpoint. And these are our research questions. They're basically what I just mentioned. And our recruitment, it's people who have had COVID, people who have had have resided in the US in the since 2020. Those are our recruitment strategies on the right-hand side. And our flyer, and we did a survey about a little over a year ago, and we conducted interviews last spring/summer. And we ended up with 135 good survey responses. We unfortunately had some bot issues. And then we got 29 interviews, semi-structured interviews that we conducted. And this is just the one quote I wanted to share. We asked this participant, how could your information related experience around COVID have been improved? And this person's response is talking about, the library being something that she would turn to, like, just leave a flyer. Some libraries had free COVID tests, and they made it simple where they even have a nurse at the library who could write you a prescription. That's it. Thank you very much. Thank you. I'm happy to take any questions. Stop sharing.
Anybody who has questions, you can put them in the chat. And while people are providing their questions, I have a couple, because you talked about some really interesting concepts, including the idea of infodemics. And I'm just wondering if there are other types of infodemics, and if there are lessons that could be learned from the way that these infodemics were handled, and the lessons learned from those, and maybe just even a summary or comparisons of how they were handled in the two instances, and then how they could be applied, how those lessons can be applied to if an infodemic is it only related to health crises, or so I have a lot of thoughts around that concept, and how
Yeah,
they how what we can learn about handling them.
yeah. Great question. I think although the term was coined during the pandemic and by the World Health Organization, it's health related in that respect, but I think that definition can be applied much more broadly, because it's like just having a jumble of lots of information. So information overload, but some of it's true and some of it's not, right? And the mess that creates for the person that's just trying to understand, like, hey, what should I do? What shouldn't I do? But I think that can go beyond health. I think there's probably lots of infodemics.
Yeah,
I think this could be a dissertation.
yeah.
um, yeah. And I think like some of the things that have gone wrong, there's the same things that went wrong during 1918 influenza pandemic and during COVID, that there wasn't a coordinated response, and the information that was getting out to the public, it wasn't getting it out fast enough. And I think misinformation beat good information to the public. And then once that happens, it's really hard to, be like, well, but wait, don't believe that. So I think, not providing information in a usable, comprehensible, and usable way for people meant that people turned to misinformation, because they're like, okay, I'm not getting this from, my government, my health department. I'm going to go on, I don't know, Facebook or TikTok and get my health information. And then also just the health literacy problems. There's been many studies that have found that adults in the US have poor health literacy. I forget what the statistic was, but it was some huge amount of US adults don't have sufficient health literacy that will enable them to stay safe and live a healthy life. And that's something we don't need to wait for pandemics to address that. And same with health disparities. Pandemics exacerbate both of those, but we don't need to wait till then. We need to address it now when we're not in an emergency. Did I answer?
Yeah, no, and so the related question, that is good lead into the other topic that I was really interested in, which is the idea of institutional memory for
Mm,
these types of incidents, because if we have to remember And you just gave some good examples of why people need to remember, what is there any activity in this area for how to remember, or is there information on what institutions
Hmm.
can do?
Yeah, that's a good question. So a little bit, very little bit. So we actually our research for the long COVID project is being funded by it's a Grand Challenges grant from the University of Maryland. And our piece of it is called the pandemic we changed it. So I'm trying to Pandemic Readiness Initiative, I think is the current name. And so we're working on that from different standpoints. Like I, of course, and my co-authors are all from an information standpoint, but there's other people on our team that are working on like water testing for COVID and things like that. So like lessons learned for next pandemic. How do we handle it better? It didn't go very well, right? So how do we do this better? And one of the projects this summer for the PRI, the Pandemic Readiness Initiative, is to take there's probably I think maybe like 6 sub-studies, which ours was just one, and it's to take all the findings and look across them and be like, okay, what are the overarching lessons learned?
Okay, we have something in the chat. Let's see. Okay, considering how medical research is now being defunded and reliable health
Mm.
information stigmatized by the government, are there lessons we can take away from how libraries responded to the 2018 pandemic when acknowledging the problem was being targeted by the Sedition Act?
Oh, wow, that's a great question. Interesting. Yeah, we have a big problem right now. Um, Yeah, so let me reread it here. Are there lessons we can take away from how libraries responded during the period? Yeah, I mean, I think library one of the main ways that libraries responded was by holding these, they called them public library lectures, and they would have like doctors come in, that so experts come in and basically help to dispel myths like, hey, don't take this what is it called, formament, don't don't take formament. And I think the public library lecture idea was helpful, but I'm sure not everybody could go to that or even knew about that. Just let me reread. We can take, yeah, from how libraries. So how did libraries respond? So they did that. They also went above and beyond their like information role, and that happened with COVID too, that they basically did whatever they could to help their communities. And we saw that from the first study I mentioned too, that, they went above and beyond. They, helped to distribute tests, at home tests, right? They helped people to set up their vaccination appointments. And I think those are like best practices, and maybe it would be helpful to kind of catalog like these were things that worked really well, and maybe catalog things that like this didn't work so well. But that's a great question. Did I answer your question, Timothy?
He can let us know. Tim can let us know in the chat,
Chat.
and then there's another and I'll follow up with that. And then this question is, what are your thoughts about the role of artificial intelligence in either addressing infodemics or adding to them?
Great question. Thank you, Tawana. Um, yeah, okay. I'm trying not to be like what is that called? Like someone who's against technology, like a um
Luddite.
Luddite. Thank you. Um, so far I've not been impressed with AI. I've like tried it out, and it like makes things up, and I actually asked it like who coined the term consumer health information justice, and it's actually my term, and it made up some guy. It said Dr. like Herbersnorfer or something like that, and I said, okay, well, who's that? And it said there's no such person. I was like, what? So I said, why did you lie to me, Chat GPT? And it wrote back and said, well, sometimes, I don't know the right answer, and just come back when you need accurate information. I was like, what kind of conversation was that? You know, so like from that experience, I would say it adds to the infodemic problem because it piles on to the misinformation that's getting out. But I think it's going to get better. Like I think AI, they're still working on it. It's still early days, and I think will get better, and maybe someday it might be able to help with the infodemic. But right now, I don't think it's ready for that.
Those have been any great questions. Let's see. So
Fantastic.
she said thank you, Beth. We just have another minute or so. Is there anything that you want to wrap up with before we remind our participants today of what's coming in the fall?
No, thank you very much. Please email me if anybody, I'm going to put my email in the chat. If want the slides, you have any other questions. Thank you very much. And thank you, Marianne. Thank you.
Yeah, thanks so much for sharing all that fantastic work. So everybody, we are wrapping up for this semester with our um, Search Mastery Speaker Series. So thank you so much for coming. This is our last event. We'll be back again in September. We're working on lining up our next series of speakers, and we had some really great talks this semester. If you remember, we had Daniel Traley last month talking about search in the news, and before that, I think we had Perplexity, the AI company, come and talk to us about their thoughts on AI and search. So we see you all next time. The recording will be available on our website and on our YouTube channel. So you can just look for Search Mastery University of Maryland, and you should be able to find in either of those channels. So that's it, and thanks everybody. We'll see you in the fall.